I mean, wow. I mean, you can spend so many hours on this. I think one of the biggest challenges in growing, commercial healthcare markets has been that for a very long time, the healthcare market on the continent has been seen as a donor-driven market. It's a market where we need to wait for the generosity of multilateral donors, because a majority of healthcare budgets are funded by these donors, and so the idea that these are actually businesses is quite foreign to most people. Like, really, a hospital is a business? No. How can you think of a hospital as a business? A hospital should be the thing where everyone goes and get something for free, right? So I think one of the first steps in creating this enabling environment really is around actually using I call it a means test approach. Our healthcare market should be built, government should apply a means test approach. There are people who can afford to pay for healthcare services, and those people should pay for it. And that those who cannot pay for healthcare services should be ring-fenced and donor funding applied to support them. But even on that, I would like a market-based approach where donors actually pay for performance. So they actually contract private healthcare providers to deliver the service, and they pay them. I do not believe that the government should play the role of both a provider and a regulator. I think government should play the role of regulator and open up provider market to the private sector. Now, there are some areas, in rural areas, where the private market would never go. And I understand it. And the government should play the role of a provider in those markets. But in markets where there is a density of payers who can afford to pay for healthcare, the government should not step in to provide healthcare. The government should rather incentivize. So take private health insurance. Government should absolutely put in place a robust health insurance infrastructure that actually works. But the government should not be the administrator of these insurance markets. The government should actually pay private health insurers to administer these insurance programs. I believe that is the only way that we can actually develop health markets. And the most important role the government can play is by building a thriving health insurance market that works, not just an idea that is on paper, that is in place, but doesn't actually work. Let's reinvent.